The causes and treatments of equine lymphangitis. Lameness. It is one of the major health issues facing the equine industry. One cause of lameness is equine lymphangitis. The term lymphangitis refers to an infection that causes swelling and inflammation of lymph nodes, which can lead to edema, or swelling due to fluid accumulation, in the lower limbs, pectoral region, ventral abdomen, and neck areas. There are many different types of lymphangitis, but this presentation will focus on lymphangitis affecting the lower limbs, mostly the hind legs. The two types of lymphangitis that can affect the hind legs are ulcerative lymphangitis and epizootic lymphangitis. These two types, however, are caused by very different microbial organisms, bacteria and fungi. Ulcerative lymphangitis can affect a horse's limbs, but usually only affects the hind limbs. According to Speer and the Merck Veterinary Manual in 2011, after a horse receives a cut or puncture wound, the wound can become infected by many different species of bacteria, including Staphylococcus aureus, Corynebacterium pseudotuberculosis, Rhodococcus equi, and Streptococcus equi. Corynebacterium pseudotuberculosis can cause severe ulcerative lymphangitis after a puncture wound. This species of bacteria is anaerobic, and therefore it only infects areas where oxygen is not present, making a puncture wound the perfect environment for it to grow and proliferate, causing an infection. Once infected with one of these bacterial species, the lymph nodes in the affected leg can become very swollen and inflamed. The swelling may be up to 2 or 3 times the normal size of the leg. This swelling and inflammation is due to the effects of the horse's immune system. According to Murphy in Janeway's Immunobiology, the immune system of an animal induces inflammation when it encounters foreign pathogen. This inflammation can cause the blood vessels to become leaky, allowing excess fluid containing phagocytes and other immune factors into the damaged tissues. Phagocytes are a type of white blood cell that is capable of ingesting and degrading microbial species, such as bacteria. Some examples of phagocytes are macrophages and neutrophils, and these cells will enter the infected tissue and destroy the pathogens. The excess fluid that is released from the blood vessels in the infected area is used to sweep pathogens, like bacteria, towards lymph nodes where B and T lymphocytes are located. These cells may then become activated to either produce antibodies against the specific pathogen in the case of B cells, or in the case of T cells, to activate cells that can kill foreign pathogen, also known as cytotoxic T cells. This swelling and inflammation are normally beneficial in fighting off infection. However, horses suffering from lymphangitis have dramatically inflamed lymph vessels and extreme swelling in hind limbs, resulting in chronic lameness and pain. In the picture to the left from Dr. Affolter's article published in 2013 in the Veterinary Clinics of North America Equine Practice Journal, a radiograph of dramatically swollen and inflamed lymphatic vessels can be seen in this draft horse's leg. The thick white vessels can be seen to the right of the joint, accompanied by tissue swelling seen as the softer gray glow surrounding the joint and bone. The horse's leg that is infected with ulcerative lymphangitis may develop deep abscesses, up to 20 centimeters in diameter, where bacteria can be found. Superficial abscesses may drain on their own or by manually lancing these abscesses. After a veterinarian manually drains the abscess, an antiseptic solution should be used to kill any bacteria remaining in the tissue near the abscess. The Merck Veterinary Manual states that the drainage from these abscesses will mostly be a thick, tan-colored, or sometimes blood-tinged fluid that is odorless. The appearance of the fluid from the abscess may help to eliminate other diseases from the list of possible diagnoses. To efficiently treat ulcerative lymphangitis, one must first determine the cause of the disease, specifically which microbial pathogen is present and causing disease. This can be done by aspirating fluid from the abscesses. If an abscess is very deep, it may be beneficial to use an ultrasound to guide the aspiration needle to the inside of the lesion. This will assure that the sample comes from the correct infected tissue and not from healthy tissue. It also helps the veterinarian to minimize tissue damage to the surrounding areas, which may happen by blindly inserting a large needle into the tissue and probing around for the lesion. After identification of the organism via testing of the aspiration fluid for pathogen, the infection can be treated with the appropriate antibiotics, provided that the cause of the infection is bacterial. According to a study done by Rezazadeh Zavoshti et al. In 2010 in the Turkish Journal of Veterinary Animal Science, penicillin and tetracycline are used most frequently to treat ulcerative lymphangitis for as little as 30 days and up to 6 months to clear the infection. If the infection is not treated in a proper, timely manner, the horse may become chronically infected and terminally lame on the infected leg. The other type of lymphangitis that can cause lameness in horses is called epizootic lymphangitis, which is also known as histoplasmosis. This infection is caused by Histoplasma farciginosum, a fungal species, and is where the name histoplasmosis is derived. It is most often seen in areas of Asia and the Mediterranean. According to Briggs' article in the Health Canadian Horse Annual Journal in 2009, this type of lymphangitis can be contracted through either a wound or from fly vectors carrying the fungus. Epizootic lymphangitis presents similar symptoms, and lameness should be treated with antifungal medications. It may also be beneficial to remove infected lymph nodes to properly rid the horse of the histoplasmosis infection. In addition to antibiotic treatment for ulcerative lymphangitis and antifungals for epizootic lymphangitis, horses affected by these diseases may be treated with gentle exercise and hydrotherapy. The lymphatic system does not contain a pump, like the cardiovascular system does, to move lymph fluid through the body. It depends upon peristaltic waves, due to smooth muscle contraction, to move lymph fluid through the system. These waves can be stimulated by gentle exercise, allowing the lymph to flow better through the lymphatic vessels and reduce the swelling. Also, applying pressure to the affected leg may also be beneficial to moving the lymph fluid throughout the lymphatic system. This can be accomplished by wrapping the leg, which may be done for the left leg of this horse, shown into the picture to the left from the website, The Chronicle of the Horse, displaying typical lymphangitis presentation. It may also be achieved through pressure from hydrotherapy, which can also be beneficial to reducing the fluid buildup that causes swelling. Due to the fact that lymphangitis of any type is a rather painful and uncomfortable condition for the horse, phenylbutazone, or bute, may be administered to keep the horse more comfortable. A diuretic, such as Lasix, may also be administered by a veterinarian to help remove some of the excess fluid buildup in the affected limb. Horses with lymphangitis may develop chronic hind limb edema and may need to be managed for this condition for the rest of their lives. The best method to treat lymphangitis is to use preventative measures to reduce the incidence of this cause of lameness. The species of bacteria and fungi that can cause lymphangitis may be found anywhere in the environment, including in the soil. It also may be spread by biting insect vectors. The best way for managers of equines to prevent lymphangitis is by keeping their facilities as clean as possible. This may be accomplished by isolating ill horses from the rest of the herd and disinfecting the facility to the best of the manager's ability. Controlling the insect population through the use of fly treatment or management of nearby water sources may also be beneficial to help prevent insect-borne pathogens from infecting horses with lymphangitis. Equine lymphangitis can cause a horse to become lame and unusable for life, leading to the animal suffering from painful swelling and loss of a valuable animal asset for the equine business. It can be caused by many species of bacteria, as well as by fungi, which are found ubiquitously in the soil surrounding an equine facility. Lymphangitis causes sensitive areas of swelling and edema in the hind limbs of horses, and this swelling can be painful enough to warrant the frequent use of bute to maintain a horse comfortably. Ulcerative lymphangitis and epizootic lymphangitis can be treated with antibiotics and antifungals respectively, along with gentle exercise and pressure treatment achieved through wrapping the affected leg or through hydrotherapy. However, prevention of infection through disinfection, isolation of sick horses, and insect control is the best method for ensuring that a horse does not become chronically lame from lymphangitis.